Hi everyone. Today we are going to discuss Nipah virus, one of the most dangerous zoonotic viruses known to human. Nipah virus is a zoonotic RNA virus. That means it is transmitted from animals to humans. This virus is important not only because of its high mortality rate, but also has the pandemic potential the virus has and the ability to transmit from animal to humans and between humans. Nipah virus was first identified during an outbreak in Malaysia from 1998 to 1999, and it gets its name from Sangai Nipah village, where the virus was first isolated. One very important point to remember is the case fatality rate that is quite high and ranges from 40 to 75%. Now let's look at the classification. Nipah virus belongs to family Paramyxoviridae, and within this family it is placed under the genus Henipavirus. It is closely related to Hendra virus, that is another highly fatal zoonotic virus. Natural reservoir of Nipah virus is the fruit bats, especially bats of the genus Pteropus, also known as flying foxes. And the interesting thing is that these bats do not get sick themselves, but they continuously shed the virus in saliva, urine, feces. And when the bat feeds on fruits, they often leave behind saliva contaminated partially eaten fruits, which play a major role in transmission. Transmission of Nipah virus occurs in three important ways. First one is the animal to human transmission. In the Malaysian outbreak, human becomes infected after close contact with the infected pigs. Second way of transmission is the human to human transmission, and this is extremely important. Nipah virus can spread from person to person through respiratory droplets and bodily fluids, especially in hospital settings. So this makes it particularly dangerous because outbreaks can amplify quickly. The third form of transmission is the foodborne transmission, and in Bangladesh and India, infection commonly occurs after consuming fruits or raw date palm sap contaminated by bad excretions. Most Nipah virus outbreaks have been reported in Southeast Asia. Countries affected include Malaysia, Bangladesh, India, and Singapore. In India, outbreaks have been reported mainly from Kerala. There is also a seasonal pattern seen with more cases occurring during the winter months and which coincides with the date palm sap harvesting. Now let's understand the pathogenesis, what happens inside the body. First of all, the virus enters through the respiratory tract or the oral mucosa. It first multiplies in the respiratory epithelium and then it spreads through the bloodstream to the neurons, to the lung tissue, and the endothelial cells. This leads to widespread vasculitis, damage to blood vessels, and severe inflammation of the brain known as encephalitis. The incubation period is usually 4 to 14 days, but it can extend up to 45 days. Patients initially present with non-specific flu-like symptoms such as fever, headache, myalgia, sore throat, and vomiting. As the disease progresses, neurological symptoms dominate, and these include acute encephalitis, altered consciousness, seizures, and rapid progression to coma within 24 to 48 hours. Even survivors may develop relapsing encephalitis or long-term neurological deficits. Some patients develop respiratory illnesses including cough, shortness of breath, acute respiratory distress syndrome, or ARDS. Gold standard test to diagnose Nipah virus is reverse transcriptase PCR, which detects the viral RNA, and serological tests like ELISA can detect IgM and IgG antibodies. These tests are then done on throat and nasal swabs, blood, cerebrospinal fluid, and urine. There is no specific antiviral treatment available for Nipah virus. So, the management is entirely supportive and it includes intensive care, ventilatory support in selected cases, control of seizures, and management of raised ICP. Some drugs like ribavirin and monoclonal antibodies are under study, but none are yet definitive. Since treatment options are limited, prevention is crucial. So, at community level, a consumption of raw date palm sap should be avoided, and foods should be washed thoroughly before consumption. In hospital, transmission from person to person can be prevented by early isolation of the patients, use of PPEs, and strict infection control practices. When it comes to controlling the disease, animal control measures play a crucial role. One of the main strategy is the continuous surveillance of the pig farms. This means monitoring of animal health closely to detect any signs of infection as early possible. And if an outbreak is confirmed, authorities may carry out culling of infected animals. Again, there is no licensed human vaccine available, although research is ongoing. And that's it for today's video on Nipah virus. If this helped you out, give it a quick like, share it with someone who might need it, and don't forget to subscribe for more content like this. Thank you for watching.